If you're turning 65 soon or thinking about switching your Medicare coverage, you've probably asked yourself this question: should I go with a Medicare Advantage plan, or stick with a Medicare supplement plan in 2026? It's one of the biggest decisions retirees face, and it can make a massive difference in how much you pay and how much freedom you have in your healthcare. Before we dive deeper, let me know in the comments, what's your age and what state are you in? I love to see who's planning smarter out there and how these Medicare changes might affect you personally. Let's break this down simply and clearly. Medicare Advantage and Medicare Supplement might sound similar, but they work in totally different ways. Medicare Advantage, also called Part C, replaces your original Medicare coverage with a private plan from an insurance company approved by Medicare. That plan handles all your benefits, hospital, medical, and often prescription drugs, all bundled into one. Medicare Supplement, or Medigap, on the other hand, works alongside original Medicare. It doesn't replace it, it fills in the gaps, paying for things like deductibles, copayments, and co-insurance that Medicare doesn't fully cover. Now, in 2026, the landscape is shifting. The Centers for Medicare and Medicaid Services, CMS, has already announced reimbursement changes that are expected to tighten margins for insurers offering Advantage plans. That means some companies may adjust their benefits, networks, or out-of-pocket caps. We're seeing some Advantage plans in 2025 already raising maximum out-of-pocket limits from around $8,300 to nearly $9,500. By 2026, many analysts expect even more variation between states. Meanwhile, Medigap plans, especially the popular Plan G, are staying more stable in benefits, but premiums continue to rise gradually each year. Here's the first big difference to understand: flexibility. With Medicare Advantage, you're often limited to a network, usually an HMO or PPO. You might need referrals or prior authorizations. And if you travel often or split time between states, you'll likely find that many Advantage plans don't cover care outside their network area except for emergencies. Medigap, by contrast, lets you see any doctor or hospital in the US that accepts Medicare. No referrals, no networks. For snowbirds or frequent travelers, that's a huge deal. However, cost is where Medicare Advantage really shines, at least on the surface. Many Advantage plans advertise $0 premiums, though you still pay your Part B premium. They often include extra perks like dental, vision, hearing aids, or gym memberships. But remember, those zero premium plans come with a trade-off: higher potential out-of-pocket costs if you need frequent care. For example, you might pay $20 to $40 per specialist visit, or hundreds per hospital stay. With Medigap, you pay a higher monthly premium upfront, often $120 to $250 per month depending on your state and plan, but then your costs when using services are minimal, sometimes even zero after your Part B deductible. And here's where 2026 could shake things up. Some Advantage carriers are tightening provider networks and adjusting prior authorization rules under the new CMS Utilization Transparency Guidelines. These rules require insurers to make prior authorization decisions faster and justify denials, but it also adds compliance costs that could lead to smaller provider lists. At the same time, Medigap plans aren't subject to prior authorizations at all. They follow original Medicare's coverage rules. If you're finding this information helpful, make sure to subscribe to our channel. We share important Medicare updates and guides every week. Now let's talk drug coverage. Advantage plans often include Part D built in. That's convenient, but it locks you into their pharmacy network and formulary. Medigap doesn't include drug coverage, so you'll need a separate Part D plan. That might sound inconvenient, but it gives you more flexibility to pick a drug plan that best matches your prescriptions and budget. Another critical point for 2026, the Part D prescription drug changes under the Inflation Reduction Act. The new $2,000 out-of-pocket cap starting in 2025 will carry into 2026, reducing drug expenses for many seniors. Advantage plans will incorporate this cap automatically, but Medigap users can also benefit by pairing their coverage with a strong standalone Part D plan. What about switching plans? If you currently have a Medicare Advantage plan and want to move to Medigap, it's not always simple. Outside your initial enrollment period, Medigap insurers can use medical underwriting. That means they can deny you or charge higher premiums based on health conditions. Advantage plans, by contrast, accept everyone during open enrollment with no health questions. So if you're healthy and considering switching from Advantage to Medigap, it's often better to do it sooner rather than later, while you can still qualify easily. Let's also address one of the most common myths, that Medicare Advantage is free. It's not. The costs are just structured differently. You might not pay a premium now, but you'll pay when you actually use services. Hospital stays, rehab, outpatient surgery, each comes with a copay or coinsurance. Medigap flips that. You pay more every month, but far less when you actually get care. For people with chronic conditions or frequent doctor visits, Medigap often ends up cheaper long-term. By 2026, the Medicare Advantage market will keep growing. It already covers over half of all Medicare beneficiaries. But growth also brings challenges. Smaller plans may exit certain counties if reimbursements tighten. CMS is cracking down on misleading marketing, and that means we may see fewer too good to be true offers. The focus will shift toward quality scores and value-based care. In contrast, Medigap remains relatively unchanged. Its simplicity and predictability continue to attract those who want stability over extras. For those comparing costs, here's an example. In 2026, the average Medigap Plan G premium is expected to range between $145 and $225 per month nationally. A typical Advantage plan might have a $0 or $25 premium. But the average out-of-pocket spending for Advantage enrollees can reach $3,500 or more annually if they have several hospital visits or outpatient procedures. Medigap users, in most cases, stay under $400 a year in total out-of-pocket spending. The question isn't just, what's cheaper per month, but, what's cheaper over time when you actually use your healthcare? Another trend to watch is how supplemental benefits in Advantage plans are evolving. We're seeing more coverage for things like healthy food cards, transportation, and even utilities assistance for certain chronic condition enrollees. But those benefits vary widely and often reset yearly. Medigap doesn't offer such perks. It sticks to covering what Medicare covers, but it's consistent, year after year, with no surprises or plan terminations. So, which one is better in 2026? The truth is, it depends on your priorities. If you value predictability, nationwide access, and no network limitations, Medigap still reigns supreme. If you're healthy, want an all-in-one package with low or zero premiums, and don't mind sticking within a provider network, Medicare Advantage can be a smart fit. The key is understanding your personal healthcare needs, how often you visit doctors, and how comfortable you are managing out-of-pocket costs. And remember, whatever you choose, it's not forever. You can revisit your decision during each year's open enrollment and adjust based on your health, finances, or plan changes. If you found this topic helpful, we've covered other related Medicare updates you'll see at the end of this video. Watch those next for deeper insights.